Welcome to everybody in our space where the main topic is CRPS. I'm Fabrizio La Rosa, an Italian osteopath who has dedicated his life in the research for treatment for CRPS patients. I won't solve all your problems at once, but I'll give you some simple advice to follow in order to deal with CRPS. In fact, this disease is unknown to many patients. Well, this is conceivable, but the fact that it's unknown even to physiotherapists and general practitioners that should be able to take care and cure you, that is strange. So, don't bother if you'll see your therapist going back and forth, trying to find a prompt solution to the problem. It's quite normal because CRPS patients are many, but very few are those promptly diagnosed. Therefore, by the time that a correct diagnosis will be made, you'll be exhausted by the suffering, the pain, and many of you will feel hopeless and depressed because you think that there's no way out. What characterizes CRPS? The main feature of this disease is pain, an excruciating pain, day and night pain. There's no rest, no end. It's even an extremely excessive pain if we only think about what has triggered it. If we take as an example our hand, in specific the wrist that is affected by CRPS, and think that if we only stroke it, it will seem as if it's going on fire. Our wrist doesn't even bear the cool air that comes out from the air conditioner or fan. You can have the same feeling when you are sitting in your car and simply put your arm out of the window. This is one of the most annoying things that my patients complain about. The unceasing pain, it's not the type of pain like the one we feel when we hit something or burn yourself, but this pain is real bad. It's an excruciating pain, the pain that springs out from your nervous system, which has a few problems. These patients can't find an answer that can explain the pain they are experiencing. My dear patients that are watching, you know that these are no miracle medicine because you have taken all types of medicines, painkillers, cortisone, antidepressant, and you ask yourself, but what does an antidepressant have to do with my problem? Well, it has to do with it. I'll explain why to you later. The fact is that nothing works, the hand or the ankle, the shoulder or the neck, or whatsoever part of your body doesn't respond to any treatment used. You become more stressed and desperate because you are conscious that there's no way out of this tunnel. Probably you've seen the orthopedic that has treated you, and after that the physiotherapist that has done all types of treatments in all the possible ways. They have treated you in many ways, but nothing works. You go back to your orthopedic and ask him what you should do to your hand. The problem is that even the orthopedic doesn't know what to do. Even if you look up for further information on books or on websites, you will find no answer. So it's not even his fault, because until today, there's no cure for CRPS. I think that I have understood why CRPS occurs. This will be the main topic the next time we meet. Today, I just want to tell you, it's not true that there's no hope to recover from CRPS. You simply have to change your approach when you think and talk about CRPS, and take a look at it from another point of view. This is something that you have to do, because if we talk about the official medical approach, no one will ever advise you to use other treatments. I'm an osteopath, but first of all, I've been a physiotherapist, and I can say that physiotherapy is useless if it is used to treat CRPS. Physiotherapy has completely failed because all practitioners have only one objective: to turn off the pain, while we need to find what has caused CRPS. This is the right modus operandi. The question to ask ourselves is why our body is aching this way. What is the message that is sending to us through the pain that we are dealing with? I don't think that ignoring this cry for help is the right thing to do. Maybe we should try to understand more. See you at our next appointment in our space about NeuroReset versus CRPS.